Hello there. In today's video, we will be discussing about encephalitis, again an inflammatory brain condition. Encephalitis is an acute inflammation of parenchyma of brain and spinal cord. It normally coexists with meningitis, which is known as meningoencephalitis. Causes are viral and other microorganisms. Epidemiology. It is a rare disease occurring in approximately 0.5 per 100,000 individuals, most common in children, elderly, and in people with weakened immune system, that is either AIDS, HIV/AIDS, or cancer. Pathology. The virus enters the blood by reaching the parenchyma of brain, cortex, white matter, basal ganglia, and brainstem. Inclusion bodies are often present in neurons and glial cells, and there is an infiltration of polymorphonuclear cells in the perivascular space. There is a neuronal degeneration and a diffuse glial proliferation, often which is associated with cerebral edema and increase in intracranial pressure. Thrombosis may occur in small arteries of the brain. Tonsillar herniation may occur due to a raised intracranial pressure. The signs and symptoms. Symptoms in milder cases of meningitis usually include fever, headache, poor appetite, weakness, a general sick feeling, which is known as malaise. In infants, the most important signs include vomiting, again a result of an increased intracranial pressure, a full or bulging frontal, again do a Kraft sign examination, crying that doesn't stop or that seem to worsen when an infant is picked up or handled in some way. This will disturb the intracranial pressure, therefore it worsens. Body stiffness. In more severe cases, there is high fever, severe headache, nausea, vomiting, stiff neck, confusion, disorientation, personality changes, convulsion, also known as seizures, problems with speech or hearing, hallucination, memory loss, drowsiness, and coma in most severe cases. Contagiousness. Brain inflammation itself is not contagious. Any viruses that causes encephalitis can be contagious. Diagnosis. A neurological examination reveals a drowsy or confused patient. Stiff neck may indicate meningoencephalitis. CSF varies from a normal to increased amount of protein and WBC with normal glucose. EEG, that is electroencephalogram, may show sharp waves in one or both of the temporal lobes. CT scan examination is done to exclude brain swelling before lumbar puncture. Diagnosis is made with detection of antibodies in CSF against a specific viral agent such as herpes simplex, or polymerase chain reaction is done that amplifies RNA or DNA virus responsible such as varicella zoster. Medical management consists of maintaining fluid and nourishment, sedatives, corticosteroids, antibiotic, antiviral, and anticonvulsant drugs. Physiotherapy management is seen for both meningitis and encephalitis, and it is on the following grounds. The aims of physiotherapy management is psychological support, prevention of chest complications, prevention of DVT, prevention of bed sores, correction of deformity, promote vital function, normalization of muscle tone, normalization of postural reflexes, promote integration of sensory input, promote voluntary movement pattern, and improve the overall function. Psychological support. Maintain a non-threatening positive attitude, good support, gain confidence of the patient, counseling of family member and patients, and only necessary information should be provided. For prevention of chest complications, breathing exercises, postural drainage, suctioning, cervical and thoracic mobility exercises, thoracic expansion exercises, strengthening of the respiratory muscles. For DVT prevention, active and passive ankle toe movements, active limb exercises, limb elevation, early mobilization as soon as possible, propped up position in bed and bed mobility exercises. Prevention of bed sore, proper positioning with pads and cushions, use of waterbed or foam mattress, regular inspection of skin, use of cotton clothing to absorb sweat, avoid dragging during transfer, regular turning and changing position. Correction of deformity, proper position. If synergy is present, go for facilitatory and inhibitory techniques. The facilitatory techniques include vibration, stroking, joint approximation techniques, quick icing, quick stretching. Inhibitory techniques include sustained stretching, pressure, neural warmth, prolonged icing, joint traction, splinting, and serial casting. For promotion of vital functions, improve the respiratory capacity with positioning and glossopharyngeal breathing exercises in case of respiratory paralysis. Keeping the neck in flexion improves the respiratory capacity. Specific position increase air entry in the targeted lobe. Massage and mechanical pressure provides a reflex stimulus to improve peristalsis such as kneading, stroking. Facilitate swallowing with position, right selection of food texture, oromotor stimulation. Maintain the cardiorespiratory endurance with active exercises, active muscle work as much as possible. Normalization of muscle tone is brought about by facilitatory and inhibitory techniques. Promotion of sensory integration, stimulation by combination of proprioceptive, visual, and auditory cues and commands, demonstration of activity, sensory re-education if necessary, and training in a variety of environment. Voluntary movement is managed by providing PNF techniques, open kinematic chain exercises to improve mobility, closed kinematic to improve stability, transfer techniques including functional challenges and a problem solving task. To improve overall function, maintenance of physical activity, maintenance of cardiovascular endurance, and early return to activity or work. This was all about physiotherapy management of meningitis and encephalitis. Thank you.